when the person is asked, can I go back to my regular activities after taking COVID vaccine?
That's a good question. It depends on what type of work you do. If your work involves, see, COVID vaccination and going out to do work has no effect at all. It's not going to do anything. You are going out to work is only making you at a greater exposure to a COVID infection. Let me tell you one thing. Just because I had COVID vaccination, it doesn't necessarily I'll have to dig myself into a cave and bury myself for the next 8 weeks or something till I get the second vaccine and then come out after 3 months. Not at all. Getting exposed to outside will not interfere with your response to the COVID vaccine. But you go outside without adopting your SMS, you've taken the vaccine, but no social distancing, no masking, and no washing hands, and you just go for a jolly ride without mask in the road, then you are at risk. You can develop a COVID infection. I can tell you one thing, sir. You might have had a COVID vaccine, but it does not mean that you should adopt social distancing, masking, and washing hands. This is a very, very important rule which I want to tell you a truth. COVID vaccination does not exempt you from adopting protective practices. SMS, social distancing, masking, and hand washing, very, very important. I took COVID vaccine. It doesn't mean I can go and sit down in a cricket match along the crowd and keep whistling away to glory when somebody hits a six. That may be the last six I see in life. So I think, we should be very careful. You can go out, but you have to be careful. Now you take all of us doctors. Now we are all working in the hospital only. In spite of working in the hospital, I'm alive today to talk to you. That is my karma, some good karma or bad karma I've done to keep talking to you at this point of time. You can't run away from problems. You cannot run away from work. But you have to be very, very careful. We also wear a mask. We wear a visor, hand washing, social distancing. Nowadays, what has happened? Personal touch of the patient has lost. And everything has become virtual communication, virtual consultation. WhatsApp video call, this video call, that video call. Now, actually, I tell you one thing. The profession also, we as doctors feel very bad that we are not able to have that one eye-to-eye contact with patients. It's becoming very difficult. Our communications time also is reduced because the greater amount of time a patient sits in my consulting room, there's a greater chance of he giving me infection. I have instances when patients have come to me, have not even disclosed to me that they are COVID positive. So an element of truth should exist in all of us. Intellectual honesty, integrity is very, very important. And all of us have a social responsibility of not transmitting the infection to anybody. So preventive practices are not excluded, are not totally abolished or terminated just because of the COVID vaccine. You can't take a COVID vaccine and walk very high in the air without a mask. That's very dangerous. It is suicidal.